Thank you for being here with us and welcome to this thought leadership session around patient-centric care delivery enhanced by digital and technological innovation. I'm David Lavajo, Vice President GE Healthcare Digital in Europe, and I have the pleasure to host this session together today. So, patient-centric is not really a new concept. We have been talking about patient-centric during a lot of years, but are we really advancing in the patient-centric journey? Are we really putting the patient in the center of the healthcare system, as we have been saying during the last years? And more even than that, are we really understanding what patient-centric is? Are we really giving the right value to patient experience and the patient journey inside our hospitals, our clinics, our healthcare systems? That's the question we need to answer, and that's the topic we will try to answer today. Just as an example, when a patient is entering a cardiology department, what is the healthcare system really seeing? It's seeing new activity, is seeing a new process, is seeing a cardiology patient, or is seeing a patient that could be cardiology, could be oncology, could be pneumology. But beyond that, are we seeing a man or a woman? Are we seeing a father, a mother, a son, a daughter, a friend? Because at the end, when you talk with many patients that are specifically in complex processes, what the main concerns that they have is not about maybe the details of the treatment or the details of the intervention. Many times the main concern is, how do I share this with my father? How do I share this with my sons? So in this approach, are we changing and transforming the healthcare having that in mind? That's what we will try to answer today, and specifically, what are the tools and the levers we need to use to make that transformation successfully? How digital can play a role in changing the way we are seeing the patients and changing the way we are interacting with patients and users. So I have the pleasure to share this panel today with Dr. Bettina Wolfgarten, Head of Diagnostic Radiology Department in Clinic Wolfgarten, specialized specifically in giving a complete different treatment to breast cancer patients. Dr. Wolfgarten is medical doctor by the University of Bonn and also specialized in diagnostic and interventional radiology and neuroradiology by the University of Essen, and currently board member of the Bonn Medical Association. We will also have Cecilia Olson, Women's Health Advocacy in GE Healthcare, a global speaker around patient experience. Cecilia has also a personal story as a breast cancer patient, and she will guide us through the journey, through the gaps that she has identified, and through the improvements that we can make. And finally, we have also the pleasure to have Patricia Nicola, Head of Venture Development and Partnerships at Wayra UK. Patricia has a finance and investor profile with a Bachelor of Science in King's College in London, and with a strong experience in investing and working with startups and working in different crowdfunding platforms. Also, Patricia is leading our Edison Accelerator program between GE Healthcare and Wayra UK to boost and accelerate innovation in the digital health sector. So I will start with Dr. Bettina Wolfgarten. If I may ask, what is really patient experience for you? So you are making a different approach in your practice, in your clinic. Why patient experience is important?
Well, thank you very much for the introduction, David. I'm very honored to be here today and talk about our experience and what we do differently. And I'm especially very, very interested to hear your point of view, Cecilia, later on about our approach. So let me just quickly introduce myself and what we do in Bonn, because that is really different from what probably comes in your mind if you think about radiology and treatment of women, especially with cancer, breast cancer. So let's start with what we believe. We very much believe that a holistic treatment of the care of women with breast cancer needs to pay a special attention to the self-government of those women with breast cancer. So basically what we did is we combined diagnostic and therapy under one roof, and we combined it with the complementary medicine, because if you look at the guidelines, if you look at the National Cancer Plan, there are 3 very important points and demands that need to be improved. One of which is we need an early and high quality care for patients with cancer, regardless of their insurance status. And then secondly, we need an integrated oncology which combines complementary medicine with standard medicine. And thirdly, and that is something I very much believe in, we need to empower patients, and we have to make sure that they get a high level of self-government and empowerment. So we thought of how can we actually translate those ideas that we all know about into action. And basically what we did is we built up a place where we have diagnostic as in radiology, therapy done by my husband, who is a gyneco-oncologist, and he does the chemotherapy under that one roof. And then also we combined lots of experts who joined the team and do complementary treatments with those women, as in yoga, resilience, oncologic psychology, nutrition treatments, all those things. And we said, let's put that all under one roof, make it an outpatient center so that those women can still live their normal lives, and let us build up a community where the women get a high level of self-autonomy and self-government very quickly, even though they are now in a status where like everything changes in their life. And so that is the idea of what we put up there in Bonn. And yeah, we are very, very grateful of the chance to give this this idea a chance. And basically we listened very well for, I think I'm in that field now for 13 years, and we try to kind of build up on the things that we have been told by our patients, and then just invent something new there. And that is something that is incredibly thrilling and really, really makes me like to go to work every day. Yeah.
Great, great. I have heard 2 very interesting things. You have talked about self-government. You have talked about community. How do you feel digital technologies can help to really achieve that self-government and that community communication successfully?
Well, David, let me put it that way. I'm a radiologist, so probably you think I'm that typical technique crazy person. Yeah, actually I am, to a certain extent, and that is to the extent that it actually helps me to be better, as in being precise and having time for the real stuff, which is being a good doctor and being someone who has time left to listen to the people. So that is the main thing. We don't do la pola, okay? So whatever helps to be precise, to be specific, to be sure about what we do, that is good, and we will do it. Whatever is there to, again, help the people and help the patients be in full charge of their own data is a good thing. So I believe in putting an electronic archive that the patients can actually rely to. I believe in open access to their own data. So anything going into that direction is really something that helps. Now we have one other thing that is something that very few people have looked at right at the moment. So we all know complementary medicine has a great deal on treatment, but then there's also another point that we personally very much believe in, and that is the power of community among the women. So we have a community board where the women just exchange their experience, and it could be anything from, okay, I have chemotherapy on Monday, is there anyone taking care of my children? Or as to I'm building up this little group of runners who wants to join me. So, or could be even something like, to give you an example I love very much, there's this one woman that my husband actually had to do a mastectomy. So throughout the years, she became an expert for nice underwear. And she said, forget about the underwear for women with mastectomy in Germany. It's rotten, but they in the Netherlands, they have really nice stuff, and also in France. And she built up this ideas, and she said, whoever gets a mastectomy should call me. I'll tell them all the good shops. And then we thought, wow, there is so much knowledge, there's so much experience. We have to actually build something that the women can interact with one another, and we have to do this in a way that is safe, that we can be sure, or anyone can be sure that it is a good source and clear data, and not some strange things going on like you might find in the internet, where you have to be honest, lots of very, very cruel things going on, you know. So those are things where the technology really helps, and there it makes absolute sense, you know, and then we go for it.
Thank you very much, Bettina. It has been great. So let's jump to Cecilia also. Cecilia, you are not only women's health advocate, you are also a patient, and you have lived in your own flesh the good and the bad things of our healthcare system. So yes, where do you see are the gaps in this patient-centric approach we were talking about?
No, so first of all, I would like to thank Dr. Wolfgarten, because there should be only places like yours, because that is patient centricity. You are adapting to the woman, not even to the patient, but seeing her as a woman. And it's not the woman that has to adapt. Because if we were to define patient experience, it's a continuum of care, but we tend to think that it starts maybe once you are at the hospital, but it starts even at the younger generations on education at a very early stage, because we only know after a journey, a breast cancer journey, what it's like. We don't know what we don't know before. So as women, as as being peers, we should all know what a breast cancer journey really is about. So I've started to educate women so they can choose. They can choose technology, they can choose their care path, because I know I was personally within the best hands and the experts, but not patient-centric. Why? Because a very traditional breast cancer journey, meaning mine, I have some key numbers, and everyone is always surprised, because I wrote a diary every day, and without even knowing, I was putting down what I felt, what I heard, what the doctors told me. Even I wasn't even in the role that I'm in today, so that diary became my strength. And I can tell you that a traditional breast cancer journey, it's more than 300 appointments. I have been traveling 3,000 kilometers. I have spent thousands of euros on well-being means, because not necessarily reimbursed. At least 13 to 14 technologies have touched my body. I have been traveling between 7-8 different sites. I have had maybe 4 or 5 referral doctors. And in there, of course, the only thing that can help me to make me self-efficacious, we speak about self-efficacy, self-empowerment, You know, that extra mile that I have to take myself as a woman. No one told me that you have the 30% extra miles to go. 70% of the healing journey will be technology, will be the treatments, but the rest you need to do it yourself. And this is something because I'm the lucky girl working for my company, having some expertise, but how does the other women does? So I cannot pretend that today the system is patient-centric in Europe, coming hopefully quickly, and that we can copy-paste your model as much as possible, having things under one roof, because the best educators are the other women that have been through that journey. Peer-to-peer education, moving out of flyers, etc. We know clinically that it will improve survival rates and clinical outcomes. And guess what? Financial outcomes for the doctors, because the more we are educated, the more you can maybe position us on a machine, better image quality, less callbacks, less errors, everything that you mentioned, that how you would like to work. So I cannot pretend that we are patient-centric, but I think we have the best actors here to build that game together. It's an overall health, topic. It should be taken really seriously at all levels, because it's about public health, clearly. It's not a buzzword. We know exactly what's behind that word. It's just not what technology, but it's a complete ecosystem where everyone are partnering.
Yeah. Well, thank you so much. You know, it's exactly those approaches that we need, and that is what I mean. Just listening to it and seeing. We have been all through the whole career of being in university, so we know how the medical part of it works. But then you actually talk to the women and you see where the failures are.
Yeah.
And tell you the truth, to be able to do something like what we did, we had to leave the system. So basically we had to really build up something new, completely new, go in there with all we have financially, with our thoughts, with all our strength, you know, and because it is not possible to fulfill the guidelines, even though everything we do is guideline based, within the normal system that is existing right now. Yeah. And you know what you said there are a couple of points I really loved, and one thing you said about the education. Just one quick thing, I don't want to overstress my time, but it's so great to have this interaction here right now. Like, for instance, what we do is we start even with classes, school classes that we guide through, because it is not a woman having breast cancer. It is a mother having breast cancer. It is a teacher, a leader, whatever, you know. And there's also some relationships, and there are some relatives. Yes. So in our team, we have a coach we have a therapist for children. We talk about sexuality. That is, we have to even be broader and look at the other ones that are guiding those women's. It's their wife, it's their husband, it's their child, whoever it is, and we even have to spread up and even have a look at those as well, you know. So it's the patient, and then it's also a greater circle with the people around him, you know, and around her.
And very often it's even more complex for them than us coping with cancer in many cases. It's even tougher for our husbands or sisters and moms. So the helping hands are key to have on board in that journey. Patient and family centricity.
Great. Thank you, Cecilia. Thank you again, Bettina, for these comments. Let me jump to Patricia, Nicola. Patricia, you are working in Wayra, you are working with a lot of startups, not only in healthcare sector, you maybe have a more cross-sector view. And things that we have been hearing, like creating a community, like giving the right tools to the user to self-manage their activity. We are seeing that in many other sectors, much more advanced than in healthcare. So, what do you need is still needed in healthcare to make that step? And what are the innovations that you are seeing that could help in that journey?
Absolutely, and I'm happy to share a few. And thank you so much for the story so far. I think I mentioned to Cecilia before, my father's been on cancer medication since 2015. It is not a patient-centric experience. I had to download a fax application on my phone so I can actually communicate with the physicians and oncologists we were working here in the UK. So I completely understand that the journey is a little bit broken and needs to be fixed, but there's steps being done towards it. So I think to answer your question, David, there's a couple of reasons why healthcare is not as customer-centric as other industries, and I'll focus on a couple of them. I think, first of all, to get a holistic view of the customer, you need access to data, and data tends to be more siloed in the healthcare sector than in other industries. So you need to join information from different places, different neighborhoods, longitudinal care records. If a hospital has 300 IT systems and a person moves across the UK in their lifetime, they probably have data across thousands of systems. It's different, for example, in financial services, where a person tends to stick with their bank for their entire life, or they don't really switch very often. For example, there's advancements in financial services. With open banking, customers can actually give access to their financial data to third-party applications. And this gives access to new products, new services. These services are meant to help them get a better understanding of their financial health and also make sure that they get the most out of their money. So in the healthcare industry, if you're looking at the same thing, if you have companies that can collect data and analyze data in a very seamless way, maybe looping in the patient like Cecilia talked about in the decision-making process, that would be very beneficial. And we're seeing companies, for example, like Smart Reporting, and Smart Reporting is actually working with GE Healthcare already. Their medical reporting platform, they're multilingual, they integrate with systems, they're cloud-based solution as well, and they're actually increasing medical record quality. And I think, secondly, there's another reason why the healthcare industry lags in customer centricity. Healthcare until now has been a necessity. So patients and customers need to have healthcare services because they're ill for one reason or another. If you look at other industries, for example, like e-commerce, they have to have a customer-centric strategy because this is how they differentiate from competition. We only have to look at Amazon, for example, to see that that's a winning strategy, right? Look what they're doing in this period as well. And their motto is customer obsessed, and they've been saying that since the beginning. Even they're losing money sometimes to be able to deliver their promises on cost. So you didn't have this pressing need to change in the healthcare industry. But there's a lot of shifts happening at the moment, which are pushing the healthcare industry towards a very customer-centric strategy. So I just want to touch upon a few of them because we're working with some companies and I think they're really interesting in the space. I think at the moment, patients want convenience. They want access and transparency for their treatment care and their treatment cost. They're using tools to get information on treatment cost, and they're also informing themselves on health issues online. They're using their medical data more. They're even more likely to choose insurance that partner with healthcare providers that have really good reviews. And that's very similar of what's happening in the hospitality industry, where we're very focused on reviews and what other customers have said about the hospitality services. So across industries, we're trying to get the same level of service and support. There's a lot of really interesting companies in this space at the moment. So I just want to touch upon a few. I think in terms of convenience, when we're looking, a very obvious example would be virtual appointments and telemedicine. So in the UK, you have companies like Babylon Health and Push Doctor, and they're convenient and accessible because they're using the devices we already have to deliver healthcare services. And even at Telefonica, for example, we partner with a telemedicine company and we're offering our customer virtual appointments because we know it's a competitive advantage to our competition. There's a really interesting, when it comes to access, I think what's really interesting is immediate diagnostic and results when it comes to medical testing. So we're working with a company, it's called TestCard, and it's at-home UTI test. So you have your testing strips with a QR code, you have a smartphone app, you can check with the smartphone app after you do the test if you have a UTI or not. And what's really interesting, they actually connect it to the healthcare provider afterwards, which is a much faster route to treatment than if you go to traditional route, which is booking an appointment, finding a time to go in, doing a urine test, and then waiting for your test results and having to go back to get treatment. So it's much faster. And there's also a really interesting shift from acute treatment to well-being. And I think I touch upon what everyone else said a little bit. More customers are monitoring their health and their well-being. There's more resources being allocated from the end of the healthcare value chain, which is treatment and aftercare, to the beginning. And I think there's an emphasis on healthy lifestyle, on mental health, on prevention and early diagnosis. And I'm just going to touch on a couple of companies that are really exciting in the space that I really enjoyed working with. So for early prevention and healthy lifestyle, you have companies like Second Nature, and Second Nature are creating a lifestyle improvement plan for those that are at risk of chronic diseases. So for example, type 2 diabetes, and they're working with the NHS in the UK really successfully. They just raised their Series B recently. They're doing very well. I want to mention mental health because I think the stigma has been raised from mental health, and there are so many fantastic startups democratizing the access to mental health services. A couple to mention would just be Headspace, for example, and Bloom, and they're working with businesses, insurance, they're working with healthcare provider to make sure that customers get access to CBT tips, positive psychology, and also mindfulness. And like you mentioned, Cecilia, being the family member of someone who goes through it, I needed support during this period, and having an app, having a mobile app, for example, that takes me through the journey, gives me tips, how to manage the patient, how he might react. This was very beneficial in the way I approached that experience. And I think just the last one to mention, for example, is in the early diagnosis space. And I just want to mention liquid biopsy companies, of course, because last year we had Base Genomics, which is actually an Oxford-based company, being acquired for $400 million after a year after a year since it was set up. And companies like Grail have raised $1 billion in the US for early detection of cancer. And I think those are extremely fantastic technologies being employed in the healthcare system now, using digital technologies and technology to make sure that we don't have to go through the journey that Cecilia had to go, or if we go through a much shorter period, and it's less invasive on your life and on your family life as well.
Thank you very much, Patricia. Great view of all this innovation that is arriving or is already here. So hearing all of you, for me, it's clear that understanding much better the whole journey of the patient is one of the first steps to really advance. So I would like to ask you, Cecilia, you were sharing with us your personal journey. You were talking about hundreds of appointments that in many times you need to orchestrate by yourself. Yeah. Also hundreds of thousands of kilometers that you needed to make for these appointments, for these visits to the different hospitals and clinics and so on, and many other points. So hearing also Patricia talking about that innovation that is already there, if we need to focus in one or 2 points, pain points in that journey, what do you feel are the most important ones that we should focus first to simplify and improve the experience that the patients are having?
No, honestly, I think it's empowering women, patients, or men, depending on their disease. But it's about applications, education, tips and tricks to really become actor. And it's about having let's say, build like kind of clinical partnership with my care provider, because I know that he lacks data to take care of me as a person, to know who I am, as well as I lack of data on where shall I go and when and what do I need to bring with me. So I think the roads are crossing each other for the care provider and the patients in terms of data. So we should be armed as well, the care provider, with the I know personal data, it's sensitive, but I'm sure it's something that we can overcome so that we can know each other a little bit better. So they know where I am in my journey, because remember, all those appointments, all those sites, all those persons, no one could inject empathy. And empathy, it's the best painkiller I know about. So empathy comes when we will reduce the care path with technology. We know that our customers today, they seek for stickiness when working with a company like us, to have the impression working with one company, even if it's multimodalities. But it's the same for a woman. We want to be in a safe harbor, to have the same look and feel, the same team, the same hands touching us. And this can only happen if you align an ecosystem of technology and apps that are all linked together. I call it one-stop shop, so one-stop clinics, because we know that technology exists today to reduce, for example, my longest waiting time, the worst period in my life, it's 10 days where you don't know if this is the last months you will see your kids, for example. That is the biggest pain point to solve. It's, as you said, the biopsy and the results of the biopsy. And this can only happen if you align technology, applications, reduce that waiting time in one day. I know that's possible. Technology exists. So I count on the care providers to have a look on what exists on the market to reduce the care path for the women, waiting time, and this look and feel, this safe harbor spirit. And once technology applications are there, this extra mile to go with the well-being, it needs to be a mandatory, because it's filling the remaining gap to heal. So it's a complete ecosystem, and health medicine, of course. There are so many things. I can be educated on things to do myself, some injections to do. In some countries in the Nordics, we educate the patients to do some injections. Of course, nothing, no dangerous stuff. But we can educate health medicine applications, remote virtual consultants with the doctor as the follow-up. This will reduce thousands of kilometers of traveling for me. So yes, telemedicine applications and educating women to even do things themselves. That's really the way to go.
Thank you, Cecilia. Great to hear. I would like to jump to Bettina. Bettina, you also have a strong experience not only in your clinic but in the whole healthcare system in Germany, other hospitals and so on. The general feeling is that the standard hospital in the system is clearly far away from this patient-centric and far away from having the right technologies and the right innovation to really close this gap when it comes to interact with patients in this way. So what do you feel as a public healthcare system, what do you feel we need to really close that gap? How to boost the system in general to advance in this line?
Well, we invented something together with GE, really, because we didn't like what we found so far. We wanted to step a little bit further. We invented a system for patients and also the referring doctors, where you can actually not only do appointments, but you can see your whole data. You can see the images. And so you just give the code to the patient, and he can give it to whoever he likes to, and then within a minute, we have to stop carrying CDs from one hospital to the other, and then I'm missing my CD. Oh, this is an MRI. I thought it was a mammography, and all those things. This is all causing lots and lots of lacks of times. It's a waste of money. It's a waste of time. So we have the system that, first of all, you can do your appointments whenever you feel like. it's stupid to like book your own flights, book your own hotel, your own restaurant, but for a doctor you still have to call him at 8 o'clock and then you sit there for a whole hour because you can't get through. This has to stop. So we did something where the patients actually, and we don't stop there. I mean, it's not like they send us an email and then someone else is putting it in. We actually trust so much into the system that we said, okay, you go right into our RIS and our radiology information system and you book your appointments right there, straight away, with no other care point of care in between. And then at the same time, within the same tool, you can actually have a look at your images and you can have a look at your reports. And you are again talking about self-government. You are actually the one in charge of it. You don't need to rely on me doing that DVD for you or sending that report to your doctor. No, it's your data. Go for it. You know. And so I think that is a very important step. And then again, what Patricia said, there has to be a high level of communication between the systems so that we know that we can actually communicate with one another. That would be very important. And then again, at the same time, thinking about how to increase technique, we also have to step back at the same moment and think, what is it that we actually need? So we can be brilliant about technique, but it is that one person, you know, who steps in and puts her hands on you and says, okay, you know, there we are. And let me just give you a quick example. We did something that is so easy and so simple to be done. We actually put up mentoring in between patients. Because we said, you know, if there's a woman and you actually have a little bench around a tree where they can meet for like a couple of minutes before chemotherapy, and then you have this one woman saying, look, in this place you are right in now, I've been sitting there, and that's like a year ago, and now look at me, and now you do it, you go for it. And so basically what we did is we put up a system where the women who have survived breast cancer can sign in and agree on becoming mentors of the ones who are newly diagnosed with breast cancer. And we just put those two people together, and we have technique helping us to make those matches, but it is only a helping step, you know. So there has to be humanity and human thinking, and the technique is there only to help us be human, you know. It is not the technique doing technical stuff, you know. Yeah, and that is something we need.
Sorry, I think we lost Bettina for a couple of seconds. I think, Bettina, you are already on. So you were talking about technique itself.
Yeah, well, sorry about that. But all I wanted to say, David, really was that is basically what we have said before. We use technique to help us be better. But we must not forget that one thing that is really important, which is humanity, empathy. And so we have to think about how techniques can help us be better, but at the same time, and that is our responsibility, we have to still keep in mind how we would love our most beloved ones be treated. And then that is something that we have to remember. And if you ask about how can we improve the system, it is simple. It is this one thing that we have to always think of, and then whatever it takes, we do it. Let it be technique, let it be communication tools, medical treatment, whatever. But then that is the guideline. So if you want a simple answer to a very big question, I guess that's the one I would like to give you.
And if I may comment on the mentoring piece, that is, I think, so important, because many persons are alone. And loneliness and silence is the worst enemy when someone is sick. And by the way, there are, because we tend to think it's costly solutions, but there are so many small little nothings that we can do, but they will change so much. For example, mentoring. There are so many associations with women, for example, like me or survivors. It's our own therapy to help other women. So it should be much more of that. It's not complex, and it's not. There's no costs linked to that, because it's a really the best win-win, let's say, duo I could see, survivor and guiding women, and empower them and inspire, to show example that it can be a positive journey.
Great points, great points. Thank you, Bettina. Thank you, Cecilia. So let me introduce a new topic, and I would like to hear your comments from all of you. So many times when we talk about patients, we think about more elder people that are used to go frequently to the hospitals or to the clinics. But what happens with young people? So we have people that has been born with a mobile in their hands, that they have never gone to a bank office or never gone to a travel agency to acquire a flight ticket, that are having everything just in one or two thumbs clicks. So they are arriving to our healthcare system, to a hospital, to go through a process or an intervention, and they are really shocked. They are shocked. Hey, exactly what you were mentioning, Cecilia and Bettina, before, the lots of appointments that I cannot schedule easily, but I need to go here and there. The information that is not available and is in different silos and so on, as Patricia was saying before. So how do we approach these new patients? What do we need to do with them? And I guess, Bettina, that maybe in your clinic you are also seeing young people. So how is your experience on that? And I will let any of you to answer.
I'm happy to go first if you'd like. I need to say, millennials and Gen Z, right, the new generation, they're digitally native generations. They like self-service tools. They are more likely to book appointments, to view medical records, and to pay bills online and by themselves. I think convenience is key, and they don't have the same loyalty to a healthcare provider because they want convenience more than a particular healthcare provider. And I think what the healthcare system needs to do, they need to implement new customer engagement models to make sure that they cater to the needs of this new generation. For example, even like with e-commerce, we're thinking about omni-channel strategy, for example, like with electronic prescriptions. But I think also on the physician side, on the clinician side, the new generation that are coming into the workforce and they're working as doctors, radiologists, they're also more digitally fluent, so to speak. They will request more and more technology, and they will trust more and more technology, especially when it's involved with clinical decision support.
No, and on my side, I think it's back to the space and the environment that we evolve within. It's how do we equip the waiting space, for example. I think for me, healing starts in a waiting room, and how we equip with maybe iPads, with some games for children or youngsters. We know that some companies partner with cartoon companies to show videos, movies, games, everything available for younger generations. And back to applications, even side bed applications, games, and everything to forget that we're patients and why we're here. And also I want to mention that there are technology that enables the generations that want to take control, for example, for the self-compression in mammography, for example. This is completely new and should attract all generations, and to not be scared for a mammo screening anymore. So, I mean, digital, it's everywhere. it's for the care providers, but as well for the patients. So there are plenty of ideas and tools to deploy for on both sides. Again, for the best winning duo or triad, maybe even.
Yeah, I guess talking about some examples from daily work. For instance, we implement iPads that the history is written, and so the patient is in the waiting room and he's doing it on the iPad, and you just store it, and then he goes to either me or my colleague, and we just call it up, and we can keep on talking to exactly where he has stopped. I mean, we cannot anymore just have paperwork being carried from one room to the other, and then it gets lost, and we start looking at it, and we try to read the scribbling and so on. Those are things that are just asked, just as I said before, making your appointment yourself. We have to provide those things, and make sure that what they are used to, that they find it to a certain extent. Also in the clinical setup, we have to really step into the everyday life of these people if we want to reach them. Yeah.
Yes, great. So we are arriving to the end of the session, but I would like to launch one last question to you all, and it's related with a concept you already introduced, Cecilia and Patricia, that is the ecosystem concept. So clearly we cannot do this alone, or our healthcare system cannot do this alone, or we have failed in the last years everywhere, every country in Europe in really implementing this approach. And as Patricia and Cecilia, Bettina, you were mentioning, we are seeing, yes, we can do it if we have the right companions and if we have the right tools and solutions that are able to complement our healthcare delivery system. So I would like to hear from you, and maybe from your side, Patricia, if you can start, is why the ecosystem is important and how we can use an ecosystem approach to make this happen.
Of course, I think to implement a customer or patient-centric strategy, you need a collaborative ecosystem because one stakeholder cannot do it alone. You need to receive and to share information in the ecosystem, and this is what we mean by open innovation. So for example, for the Edison program, we're working with startups. GE Healthcare is providing them with healthcare expertise and with data, and they're solving validated challenges provided by the healthcare providers. So it's really everyone working together. And with this collaborative ecosystem approach, all the stakeholders benefit, and they also provide better care to the patient, right? And a better experience as well. This is why we're doing it in the first place. So when we're working with startups, we're working with a startup with a close to market solution. They're working with a design partner, we call it, which is the healthcare provider, and with GE, and they're refining that solution. And if the solution is validated at the end, then the startup and GE Healthcare can think about having a joint go-to-market strategy. And they all work together, patients receive better care. And this is the ecosystem play. It has been used across industries. So for example, some of the most successful corporates are employing it. We do it at Telefonica, Microsoft does it, Salesforce with their CRM, but also in the financial services sector like Avalok, they have a platform play and they're working with fintechs. And I think that's really important to make sure that patients receive the best care.
Great, thank you, Patricia. I don't know, Cecilia, Bettina, if you have any idea on this ecosystem approach. Cecilia, you were mentioning the importance of thinking just beyond the doctor and the patient and the surroundings of this.
Yes, no, so I think we have much to learn from our friends in the United States. It's a concept really that is coming our way. The true meaning behind the patient experience and the pillars that are needed to build this ecosystem, because it's not only technology, it's not only a care path, but it's a culture. So it's a cultural mindset that needs to, a change that needs to happen. And there are, let's say, 15 pillars and that are all from mentoring, hiring, internal communication, value props within the hospitals, the say-do rate for the patients, the care path, and no assumptions never done without the voice of the patient. So they are working with the patient and family advisory boards. Nothing is done without the patient, and everything is done for them and with them. And the other pillars, of course, it's technology. It's how we measure as well how good we are to be able to fix the gaps. And as well think about what happens when a thing goes wrong. For example, within this ecosystem, it's like a domino game. What happens if a woman has a very bad experience on a mammo, for example? We know that one woman will complain to 25 persons, but only say, it was a good experience, only 10 to 10 persons. So the ecosystem, it's about reputation and the quality of care and how we measure and how we communicate around that. For me, ecosystem, it's those 15 pillars building the patient experience. And we are all actors here.
Great. Thank you, Cecilia. Bettina, you were mentioning at the very beginning of the session that you are really building that ecosystem yourself. Not only is about the doctor and the patient, you were talking about how you are putting other pieces to complement that experience from the patient and also to giving care on other areas than just the pure cancer treatment. What can you tell us about that?
Yeah, exactly. So basically what we did is we said, we know we are experts in our field. Now let's surround ourselves with people who are experts in their field. So we have Rüdiger, who's doing sports. We have 2 yoga teachers. We have 2 cooks. We have the nutrition counselor. All those guys, and then we really try to, if we do advisory boards that are much more than what is usually done in clinics. I mean, we are not like pathologists and gynecologists and radiologists and radiotherapists, but we put those guys together at one table, and then we really think of what does the patient need. And that is a kind of ecosystem that we live, and then that we really experience from one another. And then there's also another thing that I would like to quickly point at, which is a very, very valuable data that we actually keep it there, but we're not using it yet, which is I'm doing an image. Let's stick to mammography. So I'm detecting a cancer, and then I'm doing a biopsy. So I have the image, I have the histology, and then because my husband is the oncologist, we have the blood. So having talked about liquid biopsy, we really have the three main points, as in the biopsy, the blood, and the image. And if we do it in a good way, we can build up so much on this data being put together to really understand what is going on, also in the future. And there again, we need more people come together. We need a strong support, database support. We need the physicians. And then at the same time, we're actually using scores to see how the women feel during the treatment, so that we can actually keep track on what we are doing. Is it helpful? Does it make a difference? And then we can also even combine those things. And that is really a very valuable way and approach of looking at it from different point of views, with a lot of information being gathered there.
Yeah, perfect, Bettina. Thank you very much for that piece of feedback. So I'm afraid we are finishing the session for today. Thank you really for this amazing panel that we have had. Thank you for all the stories and the learnings and the feedback that you have shared has been really relevant for us all. So just to summarize maybe in 1 minute the main messages from this session. Clearly, we have seen how our current system is not patient-centric. We know that. And there are multiple situations in terms of multiple appointments, in terms of trips to visit the doctor, in terms of data, patient data that is not consolidated, aggregated, but distributed in different silos. That at the end is the own patient that needs to take all that complexity and try to manage, good or bad, the best they can to go through this journey. And clearly in all of these challenges, digital, yes, can play a role to help and support in terms of empowering the patients, in terms of giving them the tools to self-manage how they are going through the journey, also in terms of basically managing all the information in a more simple way for everyone, and that will for sure will show benefits in terms of the system, the complexity, the efficiency, the patient experience for sure, and satisfaction, but even for clinical results, by not losing information and by having the right info at the right time. So clearly digital, yes, can be a lever to move the system into a real patient-centric healthcare, and that's what we all want to do and we need to do in the next future. Thank you, everyone. Again, amazing session. Very honored to be hosting this one. Thank you. Bye-bye.
Thank you so much.
You.
Thank you.
Thank you very much. It was a pleasure.